Hello, and welcome to the Thrive in Your Workplace Technical Assistance webinars. Today we're going to review Webinar 2, the Model for Improvement. Our agenda for today is to review our objectives, provide an overview of the Model for Improvement, give some examples of how you can test the changes that you're trying to improve, and some sample case studies, and wrapping up with some tools and tips to help you get started. By the end of this webinar, you will be able to explain the importance of establishing a process for introducing workplace mental health innovation, apply the model for improvement, test changes on a small scale doing the Plan, Do, Study, Act cycle, also referred to as PDSAs, and access tools and templates to get started. Many organizations understand the importance of workplace mental health, but struggle to operationalize program ideas. We've all participated in a workplace wellness initiative that has failed to achieve the results that we hoped it would. So rather than view this as a reason why workplaces shouldn't care about employee wellness or mental health, it is an opportunity to look at the processes with which we engage and how they impact the outcomes that we see or don't see. Edward Deming is an organizational psychologist who is very famous and has noted that 85% of all performance problems are not people problems, they are process problems. The model for improvement is a simple change management philosophy that was specifically designed to allow for new programs to be tested without interrupting current business operations. It seeks to answer these questions. What are we trying to accomplish? How will we know that a change is an improvement? What change can we make that will result in an improvement? And then once you've answered these questions, doing a PDSA, Plan, Do, Study, Act cycle to test what your assumptions are. Some organizations may also have pre-existing change management programs they use, such as Six Sigma or Lean, which are also great tools. But we like to use the model for improvement because it is simple and also has been shown to be used without disrupting current workflows and processes. Step 1, set an aim. This is the opportunity to figure out what you really want to accomplish. Many places may try to do too much at once, or may be unclear about what they really want to accomplish with their workplace mental health or wellness program, and therefore don't design a program that addresses the specific outcomes and concerns that they would like. Think about the questions, what are we trying to accomplish? Are we trying to improve what, for who, and by when? Aim should be specific so that you will know what would be an improvement. Your aim should be bold, realistic, clear, concise, measurable, and meaningful. Some other folks may be more familiar with SMART objectives, which can be helpful in crafting an aim statement. SMART objectives are specific, measurable, achievable, relevant, and time-bound. The real purpose of setting a clear aim that addresses all of these different issues is to make sure that you know what you're trying to do, by when, what the impact will look like, and how you'll know if you've succeeded. All right, let's test what we've just learned. Which are the better aim statements? Pick 3. So between these two, which is the better aim statement? Help employees feel comfortable with workplace mental health. Or increase employees' knowledge about common mental health disorders and how to access care at work. 2. Which is the better aim statement? Improve access to psychiatrists for employees, or decrease the waiting time for a first appointment with an in-network psychiatrist for employees from 31 to 7 days. Or 3, managers should talk to their employees about mental health, or increase manager skills about how to discuss mental health to increase usage of EAP. I'll give you a moment to make your selections. The bolded statements are the better aim statements. As you can see, they're typically longer, more specific. They specify a direction, increase, decrease. They also have time limits, 31 days to 7 days, and identify specific activities that they want to do to achieve their aim, increasing skills, increasing knowledge. Now, step 2 is to establish metrics and indicators. And I know this can seem like an overwhelming place, but it's really not meant to be a super challenging matter. The model for improvement helps to guide the measurement of both process and outcome measures to help measure and help us understand what is happening and how it is happening. So here are the two types of objectives. There are process metrics, which describe activities and strategies that will be delivered to implement the program, and outcome metrics, which can be short-term, intermediate, and long-term, and measure changes as a result of the program. Particularly with new programs, it's very important to include both process and outcome metrics, as process metrics can really help determine if the program is being implemented as designed in order to achieve the outcome metrics that have been specified. Here are some of the common workplace mental health metrics that are measured to jog your thinking. Worker productivity can be measured in terms of changes in absenteeism, people being absent from work, and presenteeism, people being present at work but not working up to their full potential. Reduced healthcare spending. It can be measured in terms of looking at medical and pharmacy costs and quality of care. Are there increases or decreases? Are there other measures of quality of care, for instance, employees who are served in clinics that utilize the collaborative care model, a model of treating mental illness in primary care clinics that you can look at. Or the general aim to improve mental health can include changes in functional performance or reduce symptoms of stress or depression based on data collected from health assessments. All right, let's try to review what we've learned. Identify, is it a process metric, short-term, or long-term outcome metric? An increase or decrease in healthcare expenditures related to mental health prescriptions. Is this a process metric, short-term, or long-term? Increase in utilization of employee assistance program. Number of employees who visit new website on resources for depression. Increase or decrease change of employees who take disability leave due to mental health. Increase in knowledge about common mental health issues. Number of managers trained in supportive practices. Let's see the responses. Increase or decrease in healthcare expenditures related to mental health prescriptions. So this is a long-term outcome. Looking at mental health prescriptions, this would be how you were measuring this outcome, but changing mental health for individuals can take a long time and involve many different issues. So this isn't something that you would expect to see within the first week or month of your new program. Increase in utilization of employee assistance program. This is a short-term outcome. By perhaps increasing knowledge about existing company resources, you would hope to see an increase in utilization of those existing resources, which would then lead to a longer-term outcome of improved employee mental health. Number of employees who visit new website on resources for depression. This is a process metric. You're looking at what is currently happening right now as we're implementing this program. Increase or decrease change of employees who take disability leave due to mental health. So this is a long-term outcome. As you may remember from past webinars, mental health is one of the largest causes of disability leave. And so making this change will definitely take a long time, but is possible when you look at some of the process and short-term outcomes when developing a workplace mental health program. Increase in knowledge about common mental health issues. So this would be a short-term outcome. Let's say you decided to do lunch and learns about a mental health issue, and then you measured employee knowledge about that mental health issue. This would be a way of measuring a short-term outcome that could hopefully lead to long-term outcomes related to improved mental health. Number of managers trained in supportive practices. This is, again, a process metric. Many times numbers, really looking at what happened, are process metrics. So that can be a helpful tip to remember. All right, back to step 3, developing a change concept that supports your aim. So a change concept is a general approach that has been found to be useful in developing specific ideas for changes that lead to improvement. Not all changes are actual improvements over current practice, so you want to make sure that the changes that you are proposing will help lead to your specific program aim. Here are some common examples of change concepts. Laying a strong foundation, making sure you're set up for success. engaging leadership to build a business case, or broadcasting a workplace mental health mission statement across, letting folks know that this is an important issue. Reducing barriers to mental health care, increasing access to in-network mental health providers so that people have more access to affordable providers, or providing manager training to support employees with mental health issues. This can help increase employee and manager knowledge about what mental health issues are and how they may look in the workplace and guide folks to resources that they need. Adjusting program delivery. This may include introducing a stress reduction program that folks can participate in, or expanding mental health benefits to cover more counseling sessions. Improving knowledge. This includes communicating policies that facilitate a mental health friendly workplace, such as increasing flexible work policies, or creating awareness campaigns about mental health and resources and stigma reduction campaigns. The important thing to note is that, again, you want the change to be an improvement over what is currently happening. And you also want to make sure that the change will be positively affecting your aim. So for instance, let's say your aim was to help employees with depression increase access to in-network providers. And you identify that your change concept that you want to do is to provide lunch and learns about the importance of meditation. If you look and see that change concept, it's not clearly related to that aim. So if you implemented that and then measured, did this impact employee depression? It may not, because the specific change concept wasn't related to the outcome and aim that you intended. All right, once you've identified your aim, identified your metrics, and then figured out exactly what you want to do with your change concept, you want to test your concept. So this is the part of the model for improvement that I think can be really valuable. Prior to launching into a full organizational change, you want to start small with a plan, do, study, act cycle. So plan, identify the who, what, where that you want to accomplish for this new change idea. Implement the program, do, observe the test and to see what happens, and then study. Analyze what happens. Are there opportunities for improvement? Could something have gone better? Was there an unanticipated consequence? And then act. So refine the change and plan for the next. And you can do multiple PDSA cycles for one change. I know in my past experience, it has taken multiple PDSA cycles to work through a lot of the kinks in initial programming before we're ready to spread it out to other departments. So here are some tips about linking your PDSA cycles and testing your changes. Start small. So keep it to one department or one population. This can make it easier to pivot quickly as you learn and set you up for success as you identify what works and scale. Think ahead. If you're collecting data for a small department and using paper, how will that work as you add more departments? What are some of the unanticipated issues that could come up? Don't wait to begin. A very common issue with organizational change issues is that folks may spend a really long time on the plan part and really not get to the do part until very late. It's important to plan, but part of the great thing about the model for improvement and PDSA cycles is it acknowledges that you're never going to have identified all of the impacts or potential concerns that could result from your program. And you want to set yourself up so that you can pivot quickly and then adapt or scale that innovation once you've really worked through some of those issues. By using the model for improvement and starting small, you have a built-in safety mechanism for you to make these changes early and then scale up as needed with success. All right, that was a lot of information. So let's review using the model for improvement to access care. First, set a name, identify what you are trying to accomplish. Then figure out what success looks like and how you will know if you are accomplishing it by establishing some of these measures. And then identifying the changes, figuring out what types of changes or programs that you want to do to achieve your goals. Then testing the changes, making those different shifts once you learn new things about each of these programs and how it works in real life, and then implementing those changes and spreading them across the organization. Some implementation tips to repeat about using the model for improvement in your organization. Introduce one change at a time. Trying to do too much can make it really complicated for your organization to both measure if a change had its intended impact and also manage that change. Changing knowledge about mental health and creating new policies can be a very complex process. Identifying and narrowly defining an initial area of focus can help streamline implementation and provide quick and early wins to lay the groundwork for future initiatives. Think about implementing recommendations that promote change at both the organizational and employee level. Many workplace mental health interventions focus only on employee behavior, for instance, stress reduction strategies, instead of looking at root causes, for examples, policies or workloads that may be causing all that stress. While you should not introduce many new initiatives at once, creating a culture of mental health will ultimately require change at all levels of the organization. Consider the accessibility needs of your workforce. When you select workplace mental health strategies, acknowledge how and where your workforce will interact with the new supports or policies. If your workforce is dispersed or maintains irregular work schedules, you might focus on digital solutions, such as mental health apps that employees can use on their own time, or provide recorded trainings that are accessible off-site. Involve all different levels of the workforce in the decision-making process. This is huge and can be really helpful in both developing programs that meet the need of your employees and also increasing engagement in the process. Employees from all different levels will bring unique perspectives on organizational priorities and challenges. Including employees early on in the process can spark innovation, provide valuable feedback, and ultimately increase uptake and reach of programs. And then plan for broad dissemination and sustainability. Once an intervention has demonstrated effectiveness on a small scale, develop a plan to sustain the change in the current setting and subsequently spread the change to other settings. So now we're going to look at some examples about how organizations can use the model for improvement to implement workplace mental health programming. Let's try this case study. A data analytics company aims to help employees who struggle with depression. So that's sort of the specific name of the case study, but that's really the general goal of what they're trying to do. So let's look at what is the aim. Let's get more specific, breaking down from that goal. The aim that they've decided on is to increase employee knowledge about depression and connections to care via the Employee Assistance Program. So how will they know if they are successful? What are the measures that they're going to look at? They decided to look at participation in educational initiatives that work about depression, a pre-post survey of employee knowledge about depression outcome, and then appointments that are made with the EAP related to depression, again, another outcome measure, and looking at their change concept of implementing an awareness campaign about common symptoms of depression and how to make an appointment with the EAP. Also note that their measures include both process and outcome measures, which can be really great when you're trying a new program. Using the model for improvement to test this. For their plan component, they convened an implementation group and one department to pilot the program. Again, they involved their key stakeholders and identified one department to start small, which can be really helpful. Once they did this, they enacted the campaign and included the EAP's phone number in this campaign and outreach about depression and how to access resources. When they decided to study and review what had happened during this initial phase of the program, they looked at the number of hits to the campaign, including email open rates and the EAP data on utilization. But during the study phase, data showed that people had opened the emails, but were not making phone calls to the EAP. When asked, people indicated that they did not want to have to make a call to get services. Based on this information, the organization decided to act by including a link to schedule an EAP session and added information about telehealth resources and future communications to address those needs of employees. So as you can see, the organization didn't get it perfect the first time, but based on doing their short, small PDSA cycles, were able to identify the issue and course correct quickly and also set themselves up for success as they spread out this innovation to different departments. Please visit our website to join us for additional webinars or contact us to learn more. Thank you again for participating, and we look forward to working with you on future webinars.